Good morning. I am so sorry to have missed yesterday's discussion because it sounds like a fabulous entry point to so many of the issues you tackle in the field, and a great precursor to what I hope is helpful today. The world of complexity is something we've been thinking more and more about at FSG because we see organizations moving beyond sort of historical approaches to problems that are very micro in nature to wanting to think about problems at a systems level. And so that's what we'll talk about today, collective impact as an approach to collaborate across sectors when you seek to make change at the systems level. I'm going to start with a story, though, that is not related, oh no, I should have tested it, there we go, that is not related to health, but does a great job of illustrating, I think, what many of us care about in the world of collective impact and social impact broadly. I worked on a case a couple years back to try to transform the New York juvenile justice system. This system was a system in great crisis, and as part of that work, I met with a young woman who told me her story. She had been 13 years old, and she made a mistake. How many of you made a mistake when you were 13 years old? Her mistake was deciding to steal a pair of jeans that cost $150, and she was caught. And she was given 100 hours of community service as a result of this mistake. And her mom, who had 3 other kids and 2 jobs, they lived out on Long Island where the public transportation is not great, got this child to complete 96 hours of that 100 hours. At that point, she actually missed school for a day because she had to go to a doctor's appointment. But her mom didn't know that by missing school, she was actually considered in violation of her agreement to complete community service. So through a confluence of events, she actually is removed from her mom's home and put in a nonprofit that is an outsourcer that the city uses for children who are entering into the juvenile justice system. She feels unsafe in that home, ends up running away. And she runs, of course, to her old boyfriend's house where, of course, she is caught and she is brought back, but it turns out she has become pregnant. This all unfolds over a matter of 2 years, and I meet her when she's about to deliver her first child. She's living in a maximum security home for girls on Staten Island, which does not fulfill any of your impressions of what maximum security might mean in the adult system. Nevertheless, is completely unacceptable in terms of a girl who's gone through this experience and a family who has been so ill-equipped to support their child going through this. So while the system was in crisis, because if you think about this girl's experience, it's quite appalling, the system was also in crisis because at this particular moment in time, Mayor Bloomberg was suing Albany, they were suing the state, because it was costing them $286,000 per child who was in this system. And for that, the state of New York was getting a 90% recidivism rate. And Mayor Bloomberg, in his conventional style, said, forget it, I can do a better job at home. I'm not going to use this state system. Give me my own kids, I will take care of my own kids, and Albany, you can worry about the rest of the state. So we have this massive moment of crisis. At the same time, this is the summer of 2010, there's a gubernatorial election going on. And I don't know if you follow New York government politics, but in 2010, Governor Cuomo was running against a crazy guy. So everybody knew Governor Cuomo was going to win. Juvenile justice was one of his big issues. So the leaders of the system had come together and said, if we can present a cohesive approach to reform, Cuomo will support it. But we need it on his desk by January 1st. So the leaders pulled us in, and that summer and fall, we pulled together one of the most extraordinary groups of stakeholders across a state and citywide set of services around youth to develop a collective approach to juvenile justice. And I'll talk a little bit more about this example along with some health examples, but it does such a good job of illustrating the scope and scale of the problems. Maureen was just mentioning complexity. The complexity of this system, because in fact, nobody sitting around our table actually knew what the juvenile justice system was. Now, you won't be able to read this, and you don't need to. The point is just that that is the juvenile justice system on one piece of paper. And if you work in a government office in one of these little boxes, you have zero visibility into the broader system of which you are a part and the broad range of opportunities you might have to give the children in that system a better outcome. This is why I think it's so important that we reconsider our approaches to complex problems, because any one of us, any one of our organizations has a very hard time getting real traction over the system we want to change. And therein lies, I think, part of the power of collective impact in bringing the groups together to look at a system holistically and think strategically about the changes to be made. So, last point of introduction, as Maureen mentioned, I'm from FSG. We're a nonprofit consulting firm working around the world. And as a nonprofit, we think about our impact two ways. One way is through our work with clients. The other is through building the field and sharing what we learn through our client work with everybody in the field. We do that largely through speaking, through writing. So if there's other materials you're interested in, there'll be resources on the last page, and happy to have you follow up and can send you other items. So our plan for the morning is I want to give you a chance to experience collective impact first. So we'll start with that. It's a role play. You may groan if you dislike role plays. Everyone usually groans internally, if not externally, but it's okay because it's actually fun. So after you groan, you'll have a good time. I'll share some perspectives about collective impact, some of the frameworks we found to be helpful, and then we'll turn to a case study in health, some of the work we've done in Dallas around children's asthma. So that's our plan. I'm not great at being constrained behind a podium, but I'm going to do my best because they've told me it's probably dangerous to kind of wander around up here. But I will be wandering around through the next 45 minutes. So I've got some instructions on this slide. Just looking at the room, many of the tables look pretty full, but the role play is set up for groups of 8. So if your table does not have 8 people, please feel free to join another table, make some new friends. What we're going to do is on each table there is a stack of papers. There should be 8 of them, specifically. The front page of each is the same, and it will describe the situation that you're all going to be a part of. The back side of each piece of paper will tell you the role that you're going to play in the discussion. At every table, one of the roles will have a facilitator. This is sort of like if you draw the old maid card when you're playing with your kids. You are the facilitator to keep the conversation moving. There are 3 questions. It's straightforward, but one of you will be the lucky facilitator. You'll take 5 minutes to just read about the role you're going to play, and then we'll have you in a group tackle those questions. We'll take 20, 25 minutes to do that. I'll be circulating just to listen, and then we'll come back together and debrief. Questions, comments? I love it. New friends being made. You need one person. So we need one person in the front. We've got a couple tables in the back looking for people as well. I love it. The people who don't want to move are recruiting. It's brilliant. But by the way, you can only have 8 because there's only 8 roles per. We need one up in front, couple tables in the back still looking. Okay, so I'd love to start the debrief by hearing from how many of you played the role of a parent? All the way in the back. What was it like to play the role of the parent in this kind of discussion? Yes. Who else played the role of a parent? Yes, the gentleman with the glasses. What was your experience? Bad rap for U of C.
In the Chicagoland area.
Okay, great. Great. Another parent? All the way in, well, okay, the mic's, I was going to say right up in front, maybe? This will be fun. We can run you all the way around.
As a parent, I felt powerless. I was pleading for help, and everybody was talking about money and resources, and I have none of that. I had none of that.
Yeah. One more parent. Last parent. In the beautiful blue jacket.
I had a totally different experience back here. My team they were all over it. They didn't even just want me involved. They want my child involved. Can we talk to some children with asthma and what are their experiences? And can we do some YouTube videos to teach them how to use their inhalers? And so, I definitely was not powerless back here.
Okay, good. Did any other tables talk about involving children in the discussion? All right. Impressive, impressive, great. Who out there played the role of the program officer at the Washington Square Health Foundation? Yes. Maybe down in the front, can you tell us how it felt to be one of the people who actually had money coming to the table?
Well, for a change, it felt good to actually have some money.
There you go. Even if it was just for 15 minutes.
Yeah. You know what? It was kind of cool because I got to feel like the role that you could have in assuring some organization to it, rather than just being a potential piece that wants to have their say. It was neat to see how you could bring people together.
Yep. Frequently the role of funders. Who else played the role of the foundation funder? Yes, in the front. Tell us about your experience.
So from the script, one of the things I was supposed to do was, I really want to see this move forward. I really want the community to take the responsibility for that. And I felt like that was really what was happening around the table, so that was very nice.
That's
and
great.
that we wanted to see the initiative continue. That was what the foundation wanted. It was also what everybody else at the table wanted.
Great. Great. How about one more foundation representative right in the middle of the back?
As a funder, I was concerned that it would take the funder to drive the effort, but the group here was very adamant in that they would take ownership and actually come up with some collective interventions that would be measured and spread if successful. So I walked away with a good feeling.
That's great. I'm curious, in your real life, how many of you play the role of funders? Do we have many real-life funders in the room? One. All right. Well, good. I have a lot of funder comments. I'll send them your way. Great. Who represented Big Pharma, the GSK colleague? I'd love to hear from the gentleman in the purple shirt right over there. You guys are having an interesting conversation about the role of pharma in this.
So it was interesting because my group wanted me to supply them drugs.
You don't have to say what kind.
Which is fine, and I told them that I would supply them drugs, but I was very concerned about their inefficiencies within the community, and I didn't want to continue to supply drugs to, and I think the term I used was a rat hole that ended up getting nowhere. And it appeared as though, although there was a lot of great lip service, no one really wanted to man up, so to speak, and take the lead role in saying that they would drive it. And so from a pharmaceutical standpoint, it would be very difficult to pour lots of money into something that basically would be dead in a year and a half or 2 years, however long the money would last.
Great. Other folks from GSK? How about all the way in the back corner? Here comes the mic.
Well, I have to say, back here in the corner, we were very congenial, and we all worked together toward a common goal, identified where we wanted to go and what our outcomes wanted to be, and how each of the constituents at the table, including me as the pharmaceutical company representative, could help that goal. We were good. I don't know.
Good, good. One more pharma rep. Anyone else right in the middle?
Where am I going?
We talked about trying to make sure that the drugs we are able to offer make it to the patients that really need it the most, maybe those that don't have funding, and also the role of the pharmaceutical company for education.
Great, great. For how many tables did you talk about the issue of equity of the initiative? Yeah, great. Can we hear from folks who were in the Department of Health? Department of Health, we've got a couple in front. How about the woman right here?
She asked me to come to you.
Easy or hard to be the Department of Health in this conversation?
It was. I found it hard. I did, because I had a lot of issues. You know, I was concerned about my political role, and I was concerned about the fact that I was managing all of these resources in Chicago, and what were the stakeholders going to think about me and my use of their resources. Even though I did want good things to happen, I just had a lot of other issues.
Yes, absolutely. Other folks who played Department of Health, right in the front, Rick?
I was able to convey that we do so much with almost no funding, which is only happens in Chicago. I was also able to convey that I was glad others at the table, but I have to be very careful who I work with. Like, Pharma is great, but it's a for-profit entity, and I need to be careful about that. And while I want to be involved with this and try to help, like making our clinics available that aren't fully staffed like they used to be, I know that Mayor Emanuel will not allow me to fail. And if I have one failure, then somebody else will be leading the Department of Public Health.
Yes, yes.
That's Mayor Emanuel now. That's in Chicago.
Easy come, easy go in the Department of Health there. And maybe one last Department of Health comment on the side.
I decided to take on the role a little bit of a true public health practitioner, because initially I was concerned that there's no community-based organizations at the table at all.
Right.
There's one parent representing their social concerns, and everybody else represents a large, important organization. So as a true public health practitioner, I was trying to see who else we could get to the table in terms of folks that represented communities and represented social systems that could support this father.
That's great. How many of you in your discussions identified someone who needed to join the conversation who wasn't here? Fabulous. Fabulous. Great. Well, maybe just a last couple comments. Can't go through this without hearing from insurance. Who played the role of the insurers? Blue Cross Blue Shield. We've got one in the front.
Yes, as a deep pocket stakeholder here, we had some interesting conversations regarding just another initiative just coming forward in light of all the increasing costs and the lack of outcomes. And so we had a lot of discussion regarding pulling these resources together to provide opportunities, as well as, from my perspective, open to new models of reimbursement to reduce cost. So, and improving outcomes. So it was an interesting dynamic we had at this table. So as someone who has a big stakeholder in the financial component of this, we want to see improved outcomes despite the increasing cost and controlling it.
Great, great. Another insurance representative all the way to this side, one in the red sweater.
You're giving me a workout today.
Well, again, as the funder, I was very interested in what other models were out there. The paragraph referenced Boston, and I was very interested in how the city of Chicago compared to Boston in our issues and their issues. And then I was also very interested in the obstacles that were happening here in Chicago. What were the obstacles that the parent was having? What were the obstacles that the drug company was having, and the foundation person, and why were those obstacles there, and what could we do to address them and move forward?
Great. Great. Anyone else have a kind of reaction or an experience they'd like to share in terms of what your group touched on? Yeah, in the front.
Not quite a reaction or experience, but I just wanted you to know that when we began thinking about how we would align, Maureen, the first thing that hit the table was we need an asset map.
Excellent, excellent. Anyone else? Great, in the front.
What struck me when we started having the discussion about who else needs to be at the table, it became very obvious that while we've got 8 people to start with, there were so many others that it could rapidly get out of control. We said we needed somebody from the Medicaid system, the school systems, the church systems. We needed to involve the primary care physicians and many others. And I just felt like this could become very daunting very quickly.
Yeah, it's a tension in any, especially as collective impact initiatives get off the ground, this constant tension. Who needs to be at the table shaping it, because we just won't succeed without them. But at what point do we kind of die under our own weight because we've just got kind of too many people? You know, in juvenile justice, I think we were able to pare it down to 25. But that included the head of strategy for New York City Police. That included the head of the deep end of the system from Albany, a judge from the family court system, the child advocates, and at some point, one of the biggest challenges in collective impact, especially at the beginning, is actually defining the domain you want to change, because the systems are all connected. And in any one effort, even if it was the same issue, you know, asthma in Chicago versus asthma in Columbia, you would tackle it very differently because of the levers you can pull based on the dynamics of the problem. But absolutely, figuring out who to have at the table is a big early question. Anyone else? Observations on your conversation? Yeah, Rick?
Just a variation on this is that one of the things we did get into is that and again, this is Chicago, but we identified that the schools needed to be involved, and as a representative for another government agency, I said, well, I've been trying very hard to get the schools involved, and I've not been successful. And in this, one of the things to me, a value of collective impact is you might have other partners that can bring that key partner to the table when it goes beyond just the one-on-one relationship.
Absolutely, the power of the network based on who you do have at the table at the outset. And I'll say that speaks for funding as well. You know, funders frequently are involved in the early stages, and of course they're funding the work in addition to the planning for a collective effort, but they also have relationships with other funders. So one way to get a broad base of support from the funding community, whether that's private foundations or corporate foundations, is to leverage their networks as well. Great. Well, thank you for all being such good sports. I want to share some thoughts with you about our work in collective impact and kind of where it's taken us. And if some of you want to get back to your original seats, feel free to hop up and shuffle. You know, as much as we're big fans of the collective impact framework, obviously, and we see it succeeding in many different domains, it's actually not the right approach for all kinds of problems. And one thing I want to offer at the beginning here is a way to differentiate among different types of problems. So what do I mean? On the one hand, there are problems out there that I would put in the category of relatively simple problems, right? Like baking a cake. You have a recipe, you have the ingredients, you repeat, you get an expected and consistent result. So there are certainly problems in the world that fall in this category of simple. There are certainly more complicated problems. In fact, I would put a lot of healthcare interventions in this bucket, where, you know, I can't put a man on the moon. I can't perform a very complicated surgery, but there are people who can, and they have specialized knowledge, and this can be perfected with that knowledge to lead to repeatable, expected, positive outcomes. But the analog I'll use for a complex problem is that of raising a child. How many of you in the room have kids? So you know, as I know, I have 2 kids. I have a 3-year-old and a 5-year-old. And the difference with a complex problem from the simple or the technical problems is that the object, the problem itself, keeps changing. What that child needs at one age is very different from what they need a couple years later. Likewise, any one family has a different set of needs from any other family. So actually what you might do to support the child will be interpreted and applied differently based on that context. And indeed, the advice you might give parents, I have a whole bookshelf, right, of books about how to help them sleep, how to help them eat, creating lifelong learners, all of these things. But I interpret the advice in those books differently than any of you would. So the challenge with complex problems is that everything is in motion. And it goes beyond just saying, well, we can't do the same thing in Chicago that we did in Boston. It's beyond that, because the nature of the problem itself will change over time. So tackling a problem that is complex, and Maureen referenced it this morning, requires an approach that is not just systemic, but does need to be systemic, but is one that is highly attuned to changes in the environment. One that is very well established with a sense of trust among the players, such that adaptation can happen over time. And to me, that's one of the most important distinctions as you think about sort of where collective impact is helpful and where, frankly, it's kind of too big and too complicated. You know, simple problems, technical problems, there are better ways to solve those kinds of problems. But it's when you're thinking about real systems level change and complex problems that I think collective impact can be can be most compelling. You know, most of the world, I think, especially in the social sector, tends to simplify our world into these simple and more technical or complicated problems. But in fact, everything we've seen, especially for the last dozen years or so, is moving us to systems thinking, to network thinking, to working across sectors. No matter which role you played today in the role play, you saw the power of having a diverse set of stakeholders at the table. So I think the reason we need to sort of revisit is that our traditional approach really just is quite broken, in my opinion. We have, funders go out, they sort of pick a grantee, they support them to do their work. Those grantees actually try to isolate their work to sort of prove their contribution to the whole. Evaluation is largely about segmenting off, right? Because you need to sort of have that data to get the funding. And we assume that in order to get to scaled impact, it's about scaling organizations or replicating, right? Oh, this great organization, Harlem Children's Zone, that's fabulous. How do we do that everywhere? Well, that implies that we can scale the leadership, the teams. Many of you have been in management know how precious an effective leader or management team is. That you don't just find that anywhere. So this assumption that we can scale just on replication or growing organizations also has seemed to fail us. And then of course we have this assumption that we will pilot it and then government will step in and do the scaling, right? The resources will come when we show how effectively it works. And what we know is that of course that's rarely the case. So our traditional approach, while it does certainly lead to some impact, I would argue that it is more isolated than any of us would like. And that's probably part of why we haven't seen the change that many of us would have liked to have seen, given all the efforts to make progress against our toughest problems. So a different approach might involve organizations working towards the same goal, if one could be defined, measuring the same things, if that goal is universally held, thinking about the engagement of the private sector, the government sector, the nonprofit sector, corporate funders, philanthropic funders, and then the myriad of organizations that wrap around these systems. The faith-based community was mentioned. If you could coordinate the work and align it and create the feedback loops within it, we think there might be a different approach, one that leads more to this collective impact that we've been pursuing. It sounds easy, or it's certainly appealing, but it's not particularly easy. And I think that this is sort of why we've tried to distill an approach which is not rocket science. In fact, I think that resonance of the sort of 5 conditions that we've identified for collective impact, the reason they have been so embraced by the field in the last couple of years is because they speak to people's experience. It's the combination of these things that is so powerful, but any one on its own sort of makes obvious sense. So the first thing that we see for successful collective impact efforts is this idea of a common agenda. Now, I don't love this label. I think it's really much more about common strategy. This has to go beyond common vision, but really into a common understanding about how change will happen and why. I'll give you an example of how hard this can be to achieve, and you experienced it a little bit in the role play. But when we started our work in New York juvenile justice, we had a fundamental problem, and that was that everyone did not agree why we had a juvenile justice system. So for the head of strategy for the New York City Police, the reason we have a juvenile justice system is for the purpose of public safety. We can't have kids running around with guns. The purpose of the juvenile justice system, from the view of the child advocate, was to actually support kids in making better decisions, where their communities have not been able to support them to date. So she sees the world as the juvenile justice system is really enabling kids to have a future they deserve to have, given the failings in their communities. Well, those are pretty different views about why you might have this very complex, expensive system. And part of our first work was reconciling that, of course, the system has to do both, right? And so the head of police turned to this woman and said, okay, we'll let the kids with guns run around in your neighborhood, And she said, well, you really think we're getting public safety? 90% recidivism, right? So when we brought a great deal of data to the discussion, we were able to reconcile that the system had to achieve both, okay? And it had to be equitable. There are a lot of inequities within the justice system broadly, within the juvenile justice system. You probably heard a lot about the various policies in New York, stop and frisk. The racial inequities embodied in this system were also staggering and came up as top issues to be addressed. But that first step of getting everyone to agree on the goals of the work together seems so obvious, but takes time. In our case, it took almost 4 months. We had to actually go out and do case studies on other states who had done reform efforts. It was kind of funny, actually. Connecticut had just done a reform effort right next door, and we brought all the data and the quotes from the people who'd been through this, and they were like, really? Connecticut? Like, we're New York. Just because Connecticut did it, there's not much we can really take out of that. So you got to bring a lot, right? You go back, you find another one. This process takes a tremendous amount of time. Those of you who have done strategic planning know the importance of data to create a common foundation among all the parties at the table in terms of the dynamics of the problem and the opportunities in terms of solutions. It leads to the question then of what gets measured. And data is dangerous, right? There's a lot of implications from a transparency perspective associated with data. So thinking about the measurement system and agreeing on those metrics, the source of the data that will be used in tracking metrics over time, again, a very, very complex process, but essential. This ends up being the lifeblood of the entire effort when it comes to the learning part of this. And that's arguably the most important part of measurement, not just what's working, but what's working and why, and how do we take what's working in one place and take it to the next neighborhood, take it to another preschool if it's about early childhood education. The Strive example that was in one of the articles you may have read, they had working groups. So you think about the whole system of activities and where things are common. So in the Cradle to Career effort in Cincinnati, they had working groups set up around early childhood education. They had working groups set up around teacher training, around technology, around preparing for college, all the different levers you might think about as you prepare kids to go from early education into college readiness and college graduation. So they set up working groups around each of these topics. And what happened was within, for example, the working group around early childhood education, they agreed on a set of metrics, and they started tracking those. All of the preschools kept track of the same list of metrics. And some preschools were seeing better outcomes than others. But within a working group where there was a high level of trust, there's no penalties here for not being the one with the best scores, but they could actually learn from each other. Why is it working? We have very similar kinds of students, kinds of families that we're working with. Why isn't my approach working? I should try this, you should try that. And therein lies, at the small level, the data and the feedback loops that actually changes practice and improves the effort overall from the very small alignment around like-minded and like-serving organizations into the broader goals of the effort writ large. So thinking about the complementarity of activities that are needed across a system is an important step, and then actually structuring those to work. In that same Strive example, one of the organizations that was doing both teacher training and preschool education was part of both of these working groups. Very senior people sat at the table in the working groups. This was not sort of pushed down to a middle manager within in these organizations. And so these guys were in both working groups, and they found they were very, very strong at the early childhood education work, and they were not really all that great at the teacher training, and they would have actually needed to invest quite a bit of resources to become more accomplished in teacher training. So they actually decided to let the teacher training go and become focused on the early childhood education. There were other groups that were better positioned to train the teachers. This is sort of nirvana in the nonprofit world, right? We think about how do we get folks to specialize and build core capabilities. It's a fabulous example that they never would have been able to make that decision if they didn't have some of this comparative data, which is not used from a damaging perspective, from a comparison perspective, but is really used for learning and help them make a really important leadership decision. Communications tends to be one of those throwaways, like, yes, of course, you need communications in a complicated effort. Communications here, though, serves two purposes, which is why it's worth mentioning. First is that with diverse folks at the table, there's a pretty low level of trust. The government doesn't trust the pharmaceutical person, and the pharmaceutical person's worried about, being taken advantage of, and the funder is sort of like, I only have so much money, no one really gets that. So low levels of trust. communication, obviously one of the most basic ways to build the trust among the group. But the second is because communication becomes the lubrication for the system. So it's the sharing of data, the sharing of lessons, the sharing of experiences when something new is tried at some point in the system. Communication is actually what allows the information to flow and allows organizations to make use of it. So it plays a very, very important role. And we find actually many groups are not very skilled at enabling communication. And so it becomes something that organizations need to learn over time and need to be supported to do. And largely that support needs to come from the backbone organization. So you've all been part of similar structures. And you go to the first meeting and everyone's excited and the meeting ends. We say, okay, who's gonna plan the next meeting? Someone volunteers, they do the agenda and they send out the invitation and they order the coffee and everyone gets together for the second meeting. And at the end of the second meeting, you say, okay, who's gonna plan the next meeting? And no hands go up. Because everyone has a full-time job. And everyone's excited and agrees and it's important and everything's important. But there is no one who is committed to supporting the effort. So now that's when I usually look at all the funders in the room, but there's only one. So I'll tell you. Funders love to fund the kids on the floor in the preschool. They love to fund the clinic services. They need to fund the backbones. And this is unsexy. It's pretty cheap, but it's process. And lots of funders are not turned on by process. But funding process, again, is what actually allows these efforts to be sustained over time, because the people involved have tremendously full plates already. Squeezing in the time to get to those working group meetings is about all they can bear. Not to mention the fact that most of the groups involved in collective impact efforts, they are not necessarily skilled with facilitation, with group communication, with data gathering, data analysis techniques, strategic planning skills. The functions that the backbone provides are these ongoing enabling services, without which nobody shows up at the third meeting because there is no third meeting. So this is where, again, it speaks to people's experience. It makes a ton of sense. It is staggering how frequently a real backbone is in place. I mentioned that it can be relatively cheap. You think about the scale of some of the collective impact efforts you've probably seen. Some of the ones we've talked about, the juvenile justice system of New York. I mean, are you kidding me? It's like, crazy budgets. We're talking about 2 full-time people maybe, right? We're not talking about a huge structure. We're not talking about big, elaborate teams, spread out around the world in most cases. But there does need to be committed funding for a small core of people with very unique skills that can support the people that are doing the hard work in the communities. So these are the kind of 5 key elements, conditions that we see for the collective impact efforts that succeed. We see a lot of efforts that have 3 or 4 out of 5. Sometimes I have the room stand up and I say, okay, if you've got a common agenda, stand up, and then people sort of sit down and maybe you have like 1 or 2 people still standing when we ask about, all 5 pieces. And then I always want to talk to them to see if they're a case study we can write about. And then actually usually they don't have all 5, but they think they do. So it's unusual. It's unusual because it takes a tremendous investment of time up front and frankly of time over time while the effort unrolls. We've been very excited though about seeing collective impact in action. Strive is the one we've written about over the last 5 years. They're seeing actual results in terms of, for example, kindergarten readiness. So we're seeing the data coming back, showing us. The juvenile justice statistics are frankly so staggering, you kind of almost don't believe them, but almost a 25% reduction in juvenile arrests. This was in 2010. We were like getting everyone to agree that the system is not just for public sort of safety, right? I mean, this is huge. When that amount of time, a system that complex can see, nearly 25% reduction in one of the core areas. So we find that very encouraging. But again, it's hours and hours of sweat and effort by the folks involved in those. So we frequently get the question, well, what does it look like? And so I'll put up what will stand in for kind of the org chart maybe of a collective impact effort. Frequently, there is kind of a governing body, a steering committee of sorts, once something is up and running, maybe a combination of funders, key leaders within the community, and the backbone organization kind of notionally reports into them. They share a lot of the data up to that steering committee. But then the work really gets done in this next layer of working groups. So as I described, the folks in education who would be working on early childhood or teacher training or technology. And so these working groups are meeting very frequently, doing a lot of the action planning. But then, of course, they have all these partners in the field where a lot of work is happening, coordinated by them. And then the public, it's staggering, right? How infrequently the parents or the children themselves are actually at the table and engaged. And so through this, there's sort of a mechanism here through which to engage the community beyond kind of the superficial town hall meeting, at the start of the effort. And this is what, again, is so important in thinking about systems change that are interesting to think about as systems, but are only really relevant because they affect real people, right? It's always that translation. So I think it's easy to look at this and think of this as actually very hierarchical, because it sort of looks like a hierarchy. But in fact, this is actually a system that is quite organic, and in practice serves the group in a way I mentioned before, which is creating these loops for data to come back in. So it's not about actually finding, it's not about the backbone kind of reporting up to the steering committee, here's what's working, and then like forcing it back down through the system. Instead, it's within those working groups and through those touch points in the community that people are figuring out what's working, and it's sort of feeding at the working group level the improvements folks are thinking about. So it's hard to imagine how this can be. And I'll claim a little risk here. I'm going to see if I can show you a 30-second video. And this is always risky, but it's a video of birds. Birds that flock together. I don't know if any of you are studiers of flocking birds, but they have 3 rules. One rule is always fly towards the center of the flock. Don't fly any faster than your neighbor, and stay equidistant from your neighbors. And so when all 3 of these simple rules are in place, this is what happens.
And then, when the moment is right, they behave in a way that should be impossible.
What I love about this example is about the sensitivity to the environment that this approach embodies. This flock is 50 times, it's been studied, 50 times faster than the reaction time of any single bird to threat or to stimulus in its environment. And that, to me, is why we want collective impact working, because there is so much happening in the environment to take advantage of, but our typical structures just we can't have our tentacles out everywhere to find out about them. And when you have these feedback loops to the system, I think there's great opportunity. When it comes to leading collective impact efforts, it is a slightly different kind of leader. Many of you have read, I'm sure, many books about different kinds of leadership. I love the Ron Heifetz books about adaptive leadership and this balance between being on the balcony and being on the dance floor at the same time. And as leaders in your organizations and in collective impact efforts, I think there are kind of 3 things to keep in mind as you play that adaptive role between seeing the system but also being a part of it. And the first is really how to support groups in getting to shared aspirations. I mentioned it in the spirit of that common agenda piece, but at the start of these efforts especially, this requires tremendous reflection. It requires data. It requires some hard evidence that people can react to and use to understand the problem. But the people you bring together have such tremendous experience in their fields, they actually need the room and the space to reflect and learn from other things, but also then put forward and test new ideas. And they need leaders who can help them do that. I think this is marked by what I'll call kind of aggressive active listening. So, you're all great listeners, I can tell. Active listening is something we learn as we work with teams and as leaders. But kind of taking that to the next level and giving people the room and the space, asking the questions that allows them that reflection is part of what gets everyone at the table to show up to the subsequent meetings. It requires what we call this burning patience. I think there's also a deeper type of dialogue that really leads to the clarity to help a group move forward. This can be facilitated to a certain extent while, especially in the early stages, but over time, while a group is looking to identify points of innovation, identify new opportunities, the level of dialogue needs to go beyond the metrics. And that balance of quantitative data and qualitative data, I think, is what we see leaders bringing that both helps build the environment of trust that enables this dialogue, but also challenges the norms of a system without necessarily challenging the underlying beliefs. We all know it's very hard to change people's underlying beliefs. But if you can change the norms of a system, you can frequently change enough of the action to tip the scales in terms of the impact you hope to achieve. And then the last is to help people appreciate that they're a part of a very complex, not just world, but system within that world. I think, Atul's references to complexity, I love his writings on complexity, especially in health. You saw the picture of New York Juvenile Justice. Nobody sitting in our steering committee had ever seen a picture of the full system. But as leaders in a community effort, working across sectors, helping people envision their role in that broader system is a tremendous role to play and a real gift to the effort, because it's so easy for people to be pulled into their piece of the system, and they have to be. But in order to contribute to a broad systems effort, a broad collective impact effort, they need to be brought up as well. So we have been so excited about the relationship between collective impact and health efforts in particular, and especially around childhood obesity and childhood asthma. These are two where we've seen many communities applying this model and starting to see results. You're probably familiar with many of these. We've written about some of them. And I was mentioning earlier, we've just finished an article that looks at the application of collective impact in global efforts. So anyone who also does international work, let me know. It's in Stanford Social Innovation Review in January, because it's not just the domestic place-based work where we see collective impact catching on, but it's actually even within global efforts with kind of multi-tiered backbones. If you love backbones, you'll love this paper. You just won't be able to get enough. So part of the reason I think this is so helpful is to the point made earlier about thinking about community health and needing to start with the social determinants of health. Thinking about community level change, looking across the spectrum. This really broadens the range of partners that you might need to have. I don't know how many of you do work in asthma, and you may work within the health world of the asthma continuum, but you need to actually talk to the people who care a lot about mold, right? So thinking about all of these dimensions has great implications for who needs to be on the bus. Many of you already experience this. You're out in the communities, you're seeing some of these factors come to life. But we think it does have implications no matter what the issue is that you're tackling. However, there are a particular set of challenges, I think, as well in applying this in the U.S. health context. First, of course, the nature of competition. We had GSK at the table. We frequently work in issues that have multiple competitors at the table. And that competition between payers and providers and others, competing for patients or funding, you need to build a whole new set of muscles to enable cooperation across organizations who are not just foreign to each other, but actually competitors in the same field. So this is one very important challenge to the work. It has implications for how do you share the savings? To whom do those savings accrue? And how are they distributed? Again, a source of tension that needs to be acknowledged and managed throughout the work. And frequently comes up in the pursuit of the common agenda. So as you're figuring out the strategy, everyone's kind of doing the math in terms of the implications for themselves. And being transparent about that, I think, helps the process as opposed to hindering it, even though it may slow it down. And then, of course, I mentioned the importance of data and the role of transparency and how it helps with the process of learning. But of course, in health with patient safety regulations, there is a degree of data sharing that is difficult to achieve, or at least needs to be recognized and worked around in this case in order to comply. So it's a big component of successful collective impact efforts, but here has to be taken in the full context, obviously, of those restrictions. But I think it's interesting. I'll start talking in a minute about some of our work in Dallas, where, in an asthma effort that started from a health facility, from a hospital, we ended up actually involving public transit authorities and restaurant associations and after-school programs and daycare programs and EPA officials and faith-based community. And again, that long list that is relevant to any one place, but has to be considered in basically any place. So I'll close with a few minutes about this case study, and then we'll have some time for questions. In Texas, collective impact is, collective impact is being tackled, is being applied to the childhood asthma issue in the Dallas community. This is the Health and Wellness Alliance for Children. And the Health and Wellness Alliance for Children today is the name of the backbone organization, which is staffed with 4 people. And the collaborative includes a predictably huge range of organizations, healthcare organizations, the school districts, the government agencies, social service nonprofits, the faith-based organizations as well. And I mentioned this started from a hospital, so the Children's Medical Center in Dallas helped catalyze this effort, playing a role as both a convener and a funder. So they provided the funding. In full disclosure, FSG was the facilitator of the early stages. We actually still are working with this group, but they actually provided the support so that we came in and did the strategic planning, the data gathering, the facilitation, and the planning efforts. So it could have been any number of funders and any number of partners. But we're often asked this question, sort of, how does collective impact get started? Who starts it? Who initiates the first meeting? What's the role of the funder in that? And in this case, it started from that effort. And of course, childhood asthma is a hugely complex issue, a problem of epic proportions in Dallas. And the Children's Medical Center had basically acknowledged that addressing the unmanaged childhood asthma issue could not be done solely from their purview. They needed the broader community involved, and so started working with their stakeholders to bring everyone together and start working through this process of the 5 elements that they would need over time. It started with scoping the system in terms of what was needed in Dallas. And again, these are interesting because they're Dallas and they're illustrative, but this picture would look different arguably for other contexts. So the first was thinking about trigger reduction. This, in their case, ended up being largely an environmental play using schools and landlords and regulators. I've seen, lots of work over the years where trigger reduction actually can get into land use policy. Why do we idle the buses near where the poor kids live, right? So there are real challenges from this perspective, depending where you're working, to land use policy and sort of equity at the municipal level. Asthma management, largely within the medical community, but then also thinking about this foundation for wellness, which was preparing the families and the communities for what it would take to manage kids' asthma. So those were sort of the three big building blocks for them. And so you can imagine from this structure how the working groups kind of align around these big areas where you can start to see the common work unfolding. And then what they did was create a system around these 3 big pillars. Asthma management, looking at the whole range of factors here, whether it's access to insurance, the proximity to a clinic. I heard someone this morning saying, I don't have a car, I don't live near public transportation, how am I supposed to get my child to the clinic? And someone else said, well, there might be community outreach. Well, that's for education, not for clinical services. What am I supposed to do? So this is all the dialogue that happens in the context of this green box, medication, the role of the pharmaceutical companies in this. And primarily looking here at doctors, at nurses, nurses within the school system, and then also thinking more about community health workers and what the outreach might entail there. Healthy behavior, helping parents and children in schools, community actors understand the conditions, have a strong sense of their own ability to advocate on their own behalf. This is frequently a huge gap in a lot of the populations that are being served. How do you believe that someone has the ability to control this? How do you instill that in the community? And then, as I said, trigger reduction in terms of dust and pest and residue and dander in the homes, working with landlord associations, getting into environmental regulation around nearby factories in the community, as well as the allergen reduction within the school system, so the quality of air. So it leads to maybe a predictable set of goals, which then have measures. And so this slide gives you a sense of, their overall goal, that children with asthma reach their full potential. Specific indicators around child hospitalizations, emergency room visits, as well as control measures. So at a high level, you want to aggregate and learn the extent to which they're able to move the needle on those. The specific goals about ensuring that medical providers, have accessible and consistent information about childhood asthma, removing the barriers to families in order to access care, creating safe places for children to live, learn, and play, and then creating awareness and a sense of power among children in terms of being able to manage the condition. So they have a whole set of goals around high-quality health care. They actually track, the percent of children with asthma who have an asthma action plan. This also helps serve, equipping children and families. They use that metric to help inform their work on both dimensions. In terms of improved access to care, they track the percentage of children who never fill the prescriptions that they're given for asthma medication, who only fulfill a portion of them. In terms of asthma healthy physical environments, they track percent of households where asthma triggers are found. Of course, you need a huge baseline study to help do that well, but that's an important piece of investment up front to know that the effort is making progress. And as well as the percent of schools who maintain indoor air quality at acceptable levels. So these become the metrics that they report. The backbone primarily is responsible for collecting, for sharing with the different working groups, determining what folks are doing such that these data are coming about, and then supporting the learning process within those working groups to see change. You will be familiar with many of the solutions that they have come up with, whether it's advocacy around busing regulations, whether it's around public service announcements and broad behavior change campaigns in the communities, or whether it's around new types of certification for medical professionals in terms of specific expertise in childhood asthma. Medical personnel who may or may not typically be seeing kids, but who need this expertise in order to support the community or parents in this effort. So I'll share, before opening up to questions, I'll just share a few of the lessons learned from these. The first is that, of course, success depends on bringing together the diverse set of players, other organizations outside of the healthcare arenas. We've talked a bit about that. But I think the shared ownership among competitors, it is possible. It is not easy, but it is possible. But it's really only possible if it's clear that no one owns the agenda. My worry about the private sector, or we work with a lot of companies, and many of them say, oh yeah, well, collective impact is probably the right thing for this problem, right? And maybe the answer is yes, but very few companies actually are able to kind of let go of driving the agenda, largely because of the pressures they have when they go back to their offices and the people they report to. But for anyone in this situation, being able to let the agenda evolve from the group simply flies counter to how we think about leadership and management within any single organization. In the Dallas example, all three of the Metroplex hospitals, they were all treating children, and they were all representatives on the steering committee. And they realized that they could all gain by reducing emergency room visits from asthma-related incidents. But they could not be the drivers. They could simply be participants. And so that cooperation is possible. The shared ownership can happen. But again, it takes some of the time, the trust building, and the new muscles for many of the groups at the table. I think the third point is an interesting one. It's tough to maybe always accept why a certain organization would join an effort like this. And accept that their reason may not be because it's good for the kids, which would seem like the obvious reason. You know, in Dallas, the school system was involved because obviously asthma affects children's ability to learn, but their budgets are set based on average attendance. And all the absences from school were affecting their average attendance numbers, which had implications for their budgeting. Maybe not the most obvious reason, but a very valid reason for them to be at the table, and for everyone else to not judge them that that was their reason. Similarly, in that same example, there was a whole group called the Hispanic Contractors Association, and they were there because for their members, childhood asthma was keeping their members away from work, and they had a very hard time negotiating on behalf of their members when their members had a disproportionate number of absences due to this issue. So again, an important person representative to have at the table, maybe not there just for the first reason being because of the kids, but that's okay. And then last, you know, the local context obviously is extremely important in thinking about that stakeholder engagement. For some communities, you can't get anything done, you know, without the faith-based community. In Dallas, they apparently have the nation's largest junior league association that has most of the influence over all volunteerism in the state of Dallas, or in the city of Dallas. Could be a state, I guess. But therein lies an amazing resource, right? So you may not obviously think about calling the junior league for your asthma problem, but you know what? It's an army. It's an army of volunteers. So it really, as you think about the players, there's sort of the obvious players, there's some indirect players you kind of get to in the first couple meetings, but by really digging deep into the dynamics of a community and how change happens in that community, you can think really creatively about who you want at the table. They may not be at the table as the initiative starts, but again, there's nothing static about these. People come, they go, they engage, they play a certain role. It may be time limited. That's okay, but they all represent resources to potentially harness. I'll offer just one last thought. The three big mindset shifts that we see that need to happen to make this work unfold successfully. The first is this shift from expecting technical solutions to solve what are really adaptive problems. And this shift in problem solving from a technical mindset to an adaptive mindset is a big one. This allows the answers to come from within. It doesn't expect that there's a simple thing we're ultimately going to find, which relates to the second. You know, there are no silver bullets in any of this, but in Al Gore's words, there's silver buckshot, right? Lots of small efforts happening in a certain place can tip the system. Indeed, that's all that ever has, right? In the famous quote. So this is worth pursuing, if for no other reason, because if you can align all of those efforts, you see great power and progress of the effort overall. And last is this shift from seeking credit for one's work to being satisfied with the credibility that comes from being part of a large, successful effort. This one, again, very tough given the dynamics, especially in our philanthropic communities, about wanting to see metrics and outcomes. But we work with a lot of funders who have actually started to change their own views on outcomes and seeing contribution versus attribution as being very, very powerful. I think it's this shift from credit to credibility that will allow organizations to come to the table and not need to control the agenda, and will also allow organizations to come to the table and champion the work of the collective as opposed to only their own work. So I will pause there and would love to answer questions. We have about another 5 minutes. Any questions? Anyone? Anyone want to go to Dallas and see what they're doing? Great. Thank you all for the time this morning. It's been tremendous to be part of your day. Thanks.